And now I start with dengue in pregnancy. Now, please be very, very vigilant. This is the topic asked many times in your examination. If I'm the examiner also, I'd love to set up a question on dengue because there's so many things to be asked in dengue. Okay, and very conceptual things, because dengue is not just dengue, infection as a whole. A lot of conceptual things can be asked from dengue. For example, how to manage a patient with increasing hematocrit and decreasing intravascular volume, and how and why the complications arise in dengue, and what are the three phases of dengue, how a patient slips from one phase to the other, how can you help the patient, when should you admit a patient, when can you manage it on outpatient basis, what do you do when you admit a patient, what are the ways in which you monitor the patient, how do you decide about the time of delivery, whether or not you do give blood and blood products, how to decide how many blood products have to be given, and when to stop, how to monitor it, the patient post delivery. So a lot of things can be asked in dengue because it's a very conceptual topic and at the same time a very important topic from Indian perspective. So even I've included cases like tuberculosis in pregnancy and I've taught you, right? So let's start with dengue now. Dengue fever, it's a viral disease of four very closely related serotypes, and patients who've already had dengue before, sometimes they get dengue again, and then they're like, I just had dengue before, it can't be dengue and it can't be this bad. So just tell them there are 4 serotypes available. Okay, and you can get infected 4 times with 4 different serotypes if you're really unlucky, and if you're living in a very highly mosquito infested areas. So this is a flavivirus, it's an RNA virus, okay? And Aedes mosquito is particularly notorious in spreading the infection. And most of the states in India, they are dengue endemic. Early detection and access to proper medical care, that has reduced the fatality rate from 20% to 1%. Okay, and let me tell you that India happens to be a very, very important home. Not only India. Now, let me tell you certain, burst a few myths of yours. We used to believe that they breed in dirty water. It doesn't happen. A dengue virus has been found in places like Singapore. Okay, so it's not any endemic or, what do I say, like in malaria, there's an endemic zone, there is not an endemic zone. Certain areas are not endemic for malaria. But in case of dengue, 40% of world's population, it lives in dengue prone zone. Okay, so there is not a clear-cut demarcation whether India happens to be one of them, but definitely India is. So we need to know about dengue. And not just that, dengue fever is a notifiable disease. As you can see over here, it's a notifiable disease. So we have to notify it to the medical officer. Now let's understand the course of this dengue disease, through which we'll be able to understand everything which is going to come in the next slides. So the dengue viral infection, basically, patients are usually asymptomatic. I wouldn't say asymptomatic. I would say that they cope up well. They will have, definitely they'll have some of the other, manifestations or clinical features like fever, malaise, lassitude, extreme weakness, I'll say, loss of appetite. But 20% who are symptomatic, they'll be very badly symptomatic, like with dengue fever, dengue hemorrhagic fever, or shock. Okay. So just quickly run through these diseases. There are 3 kind of stages. One is febrile stage, one is the critical stage, and one is the recovery phase. So very clear cut, the demarcation. Febrile phase, when the patient is having fever. Critical stage starts right from the decrease of the fever till the patient finally starts recovering back. So critical stage is very important, in which the patient can go this way or that way. So critical phase. And the recovery phase is the recovery phase, of course. So febrile phase is the one which has fever with headache and arthralgia, myalgia and all that, in which the tourniquet test comes out to be positive. And in one of these slides, I'll be including what exactly is tourniquet test. Critical phase is the one where fever starts subsiding, but the warning signs appear. Very important, guys, very important. Where the fever is subsided down, but the critical signs appear. Something like that was also there in COVID, right? So you'll find some similarity between when we were studying about COVID, if you remember, and this phase of dengue, that there is some similarity between these 2 aspects. So here you have, when the fever abates, the warning signs, they start appearing. And if you do not give due importance, because now, the patient is all right, now fever to nahi aa raha, now the fever is okay, patient is fine, discharge. That's the time where you have to be very, very vigilant on the warning signs. You have to educate the patient even if you're discharging them home, especially in a setup like India, where we have less bed to patient ratio. And then comes, of course, this recovery phase in which everything starts becoming back to normal. The WBC count becomes okay, the platelets start rising, the hematocrit stabilizes. Otherwise, usually the hematocrit will rise, the platelets will go down, and the WBC count will also either increase or stay normal. Very important is this time period, So for 1 to 4 days, the patient is going to have severe fever, maybe fever with chills, high-grade fever, malaise, lassitude. And then the patient is going to start getting better from the fever. From 3rd to the 6th day, the patient will go. That phase is very, very important. The first 3 days, though she had, fever, you're obviously at your toes taking care of the patient. When the fever goes, that's the stage at which you have to be more vigilant, because that's the stage at which the patient can deteriorate fast. And then comes the next 3 days in which the patient will recover and probably recover fully. But here you have to be very vigilant with 2-3 very important parameters: the urine output, hydration level, and of course the blood test in which the hematocrit, the WBC count, and the platelets. These 3 parameters are very, very important, and they'll tell you a lot about the patient. So let's study these phases in depth. What is febrile phase? What is critical phase? What is recovery phase? So febrile phase, you'll have very high grade fever, okay, day 1 to day 7. Facial flushing, erythema, and all those things. Body ache, arthralgia will be maximum. There is a possibility of having rash. Many people don't have rash. Even if the rash is there, it's like measles, okay, that petechial kind of rash. On physical examination, mostly you will find everything normal. You might do a tourniquet test, which will come out to be positive, which is this, okay? You just inflate the BP cuff to a midpoint between systolic and diastolic blood pressure for 5 minutes. And if you have more than 20, we say usually, over here, we take it on the cubital fossa. More than 10 or 20 petechial spots, 10 is always the safer way to go, appear in 1 square inch, then it is a positive tourniquet test. Be very, very mindful right from here. The earliest abnormality in the complete blood count is a progressive decrease of WBC count, okay? And that should alert the physician to a very high probability of dengue. Okay, decrease of WBC count. Wait, I'll put a different color to it. Right? So normalization of W is very good. It's a good sign, but decrease in WBC count. See, if you call somebody, some patient with, go for a CBC. Okay, CBC is come back to be positive. Platelets have not started declining. WBC count is on the low. Oh, you're not having any big infection because the WBC count is almost okay. Well, you can go back home. Actually, the WBC count is declining over there, which is not showing properly. See, if the WBC count is, let's say, between 4,000 to 11,000, and if it has gone to 2,000, you will be alert. But if the WBC count is, let's say, towards the lower side, somewhere around 4,000, 5,000, you might, not notice it, because actually it is in between the due range. But just imagine a patient who's pregnant having fever. Why should the WBC count be so low? It is towards the lower side. So always be vigilant, okay? Reading every report. Then we'll talk about the next, that is critical phase. Very important, because here is where the chances of saving vis-a-vis losing the patient arise. So when the fever starts subsiding down, one of the following complications they can develop if you are not intervening in time. So what happens over there is that significant leak from the intravascular compartment to the extravascular compartment is taking place. So there's a lot of edema, but at the same time, rise in hematocrit, decreased platelet count, and maybe normal to low WBC count. So the patient can go into shock or uncompensated shock also over here. Organ system might also be involved. Hemorrhagic manifestations will also take place. Not in obviously the erythrocyte, but platelets. And if the patient has been given some NSAID, then heavens be with that patient, because not only was your platelet count decreasing, you have also stopped the manufacturing of the platelets because you're giving the NSAIDs to the patient. And what will be those warnings? How will you know that the patient is slipping away in this phase, this critical time? You're watching over the patient, but how do you know without, for example, the patient was at home, okay, the fever decreased down. Now people are happy. Okay, fine, the patient has recovered from dengue. Till the time the fever was there, they were like very, very vigilant, running around here and there and trying to get the tests done. And they even got the tests done, which were almost coming normal, like I just told before. And now they are happy, the patient is fine. So what all things significantly would you be able to looking forward to? For example, you educate the patient that fine, right now the tests are okay, but this patient has a high risk of getting going or slipping away into the critical phase. You should look out. The second question will be, what do we look out for? What are the clinical symptoms to tell if this patient is going from bad to worse or recovering? Here you have to say persistent vomiting, abdominal discomfort, decreased appetite, patient is unusually lethargic. This will prompt you to bring the patient back to us. Keep looking at the hydration status, keep looking at the tongue of the patient, because usually these patients will be very, very volume deprived. Okay, so you have to look. These are going to be the symptoms. Obviously, they cannot see the liver size increase until unless they've got the test done. They'll not be able to understand whether WBC count is increasing, decreasing, staying normal, platelet count has decreased or not, hematocrit has increased or not. Even you can't assess. So you just tell them to get this test done every alternate day in that critical phase, so that you can pick up the patient faster. That's the idea. Here I've tried to include the tourniquet test, which is this. Okay, so you inflate the BP cuff to between the systolic and diastolic, somewhere in between. Let's say if it's 120 and 80, to you kind of pump it up till 100 and stay there for 2 to 5 minutes. And then if you see these in cubital fossa, these petechial rash, something like this appear in 1 square inch, if there are more than 10, it's a tourniquet test positive.